Please start, madam.
Yeah. Good evening to all. On occasion of World Down Syndrome Day, 21st March 2025, we at Maharashtra IIP and Maharashtra IIP Women Committee presents our second episode of new series of academics, that is Thursday Thrill. भारतीय संस्कृतीनुसार वसुधैव कुटुंबकम हे विश्वची माझे घर. हे पूर्ण विश्व एक परिवार आहे. Based on this theme for this year is improve our support system. It is not about celebrating the disability, but it's celebrating ability. We all, as a family member, definitely should support to each and everyone. And that is the theme for this year, that improve our support system. For this program, we have today's chief guest, Dr. Atanu Badra, Treasurer Central IIP 24-25. We have two eminent speakers, Dr. Sonali Padhe Maitre, Dr. Nyandev Chopre sir. At the outset, I welcome today's guest as well as today's speaker. At the outset, I request, first of all, I welcome Maharashtra IIP President, Dr. Sanjay Pakmode sir. I request Pakmode sir to give welcome address for this session to start. Without the support of sir, it is difficult to have such type of program for Maharashtra IIP Academy. I request Dr. Pakmode sir.
Namaskar. Good evening. Thank you for kind words, Dr. Pratibha madam. Today is our particular program of Thursday Thrills, which is exclusively organized by our women's wing, and which is a very strong team, which is very strong pillar of strength for our MAHAIP. All the 10 people are so strong in every aspects. We tell them something and they do, means they in a fraction of in a day also they are ready for the preparation. First of all, let me welcome Dr. Atanu sir, Treasurer Central IIP. Then today's speakers, Dr. Gyandev Chopre sir and Dr. Sonali Matre madam. And today's MOC is Dr. Pratibha Kale madam, and in absentia, Jayasri Shivalkar madam. And our dynamic secretary, Dr. Amol, and convener, Dr. Sanjay, and other office bearers of MAHAIP, CIP, and all the attendees who are attending today's program. Last Thursday Thrills, we have celebrated, we have done the program on the obesity. And this time, tomorrow is the Downs Day, World's Down Day. And on the eve of that, the day before we are celebrating this Thursday, Thursday comes immediately before the 21st. That's why we are celebrating on today only. On behalf of the World's Downs Day, we are going to, we have invited two speakers for this particular program. Now, as madam has said, the today's theme for the Downs, this year, every year there is a theme for every function, every day we celebrate. Now, why the theme is there? Because we have to work on that particular path. If we will not decide what is a tagline or what is a theme, then we'll not be able to work in that particular passion. We are working for the Downs since years, but still it needs something which is concrete in that particular year. So here we are, in this year, we have given the theme that is improve our support system. Support system means we know we had plenty of Downs babies around us. Everybody is very sympathetic around, but they don't want sympathy from your side. What they need is, they also want inclusion in the society like us. They should be accepted as they are. They should not be isolated, whether it is the educational part, whether it is the social participation, or whether it is anything. They should be included in that. Then only we'll be able to make them friendly with us or grow with us like that. Because Downs have so many things. Downs babies have some problems. They have some intellectual problems. They have got low IQs. So we know they cannot cope up with us. They cannot cope up in the normal school. But if something repeatedly tell them, they can be the masters. They are very good in the music. They are very social people. I was reading a book that day where it was telling the Downs person was working in one of the star hotels, and every guest while leaving used to put a note for that particular person, in spite of hundreds of staff members. The way he used to host the people, the way he used to serve the people, what was awesome. So there is some speciality, a peculiarity about these Downs babies also. If had been they have been included in. So in this year we have the support system. So we have to strengthen our support system so that we can make them means cope up with our normal society. So with the short remark, I hand over the mic to Pratibha.
Thank you very much, sir. Just what you said, they want to just enter in the society and just they want the support from us. Just I want to quote one example. When I was sitting in my medical college OPD, Dr. PDMMC, just we were all, my HOD, professor, assist professor and my resident, we all were sitting, and one baby known to us, familiar to us, just came in OPD आणि आली आणि मला जस्ट चिपकली, मावशी 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 करत. एव्हरीबडी वॉज लुकिंग की ही हिला येऊन कशी काय चिपकली. बट दे वॉन्ट the support, they wants the emotional support, they wants to just involve in a social activities and social events. Definitely, sir. Now I welcome our young, dynamic and enthusiastic Maha-IP Secretary General, Dr. Amol Pawar. Dr. Amol Pawar, just I request you to say a few words on this occasion.
Thank you. Thank you, Pratima ma'am. First of all, I welcome our chief guest of the day, Dr. Atanu Badra sir, who is also treasurer of National IIP, and he is also chief organizing secretary of Pedicon 2026, which will be held in Kolkata. I also welcome Sukanta Chatterjee sir, a senior person, a mentor to many. He is past chairperson of adolescent chapter. I also welcome EB members, Dr. Kalpana Datta ma'am from Kolkata. I welcome today's speakers and the expert in the field, Dr. Our own Nandev Chopde sir from Nasik. I think this is the fourth consecutive year in which he has been the participant, or he has been the speaker expert for this Down syndrome activity of Maharashtra IIP. And as Dr. Sanjay Pakmude sir has told, that one of the person, one of the candidate, one of the this child who was adolescent, and he was working in 5-star hotel. So in 2023, we conducted a webinar, and in which Mr. Pranay Burde was the one who spoke on Maha-IP platform, and he shared his topic. His topic was, what does it look like to live powerfully with Down syndrome? And in that same program, one parent was there related to Nandev Chopde sir. His child is having Down syndrome, and he also spoke about the expectation and realities of a parent of a child with Down syndrome. So thank you, Dr. Nandev Chopde sir, for always giving consent to us to go ahead with the programs, and in your mentor, and you are doing lot of activities for these children with special needs. And also I thank Dr. Sonali Pardi, who is zonal EB member of Maharashtra IIP Human Committee, for coordinating this program. So I wish happy learning to all the delegates, and over to you, Pratibha.
So thank you very much for your guidance. Our convener, Maharashtra IIP, Dr. Sanjay Deshmukh, is with us. I request Dr. Sanjay Deshmukh to say a few words.
Good evening. As a convener for MahaIP, I firstly welcome you all on this our academic platform. As you know, our women wing is taking the lead since this year, and this is second activity after Obesity Day celebration. And we are celebrating Downs Day, World Downs Day today, and we have the chief guest, our own Dr. Atanu, the treasurer and organ secretary, Pedicon, Kolkata. We welcome you, sir. And as rightly said by Dr. Sanjay Pakmade, sir, Down syndrome, the theme is very particular this year. And this year you have to improve our support system. And I'm very happy our dynamic Amol Pawar has rightly make WhatsApp message. If anybody has read, I don't know. Yes, beautifully written. Having Down syndrome doesn't stop us from doing what we love or what we want to do. We have the same wants and needs as everyone else. So this single line is implemented. This baby need the same care which the other baby we have to give. So Amar, fantastic. You are always on bang on the according to the theme of the webinar. And today we have our own Dr. Chopade sir. We have long relation with him, and he is a dynamic person in genetic and Down syndrome. One must visit his genetic lab in Nashik if you are going there. And we have a young dynamic Dr. Sonali Pahadi. Both the speaker will discussion on the Down syndrome. I congratulate MahaIP Women Wing, Dr. Pratibha Kaya ma'am, Jaya ma'am, and we wish all the best for today's seminar. Thank you.
Thank you, Dr. Sanjay. Dr. Jaya madam. Dr. Jaya Shivalkar madam, our own chairman for the Women's Wing Maharashtra IIP, guiding us throughout this journey. I think madam has not joined. Okay.
Pratibha ma'am,
Okay.
I also welcome our Dynamic Secretary General, Dr. Yogesh Parikh sir.
Okay.
So I request him to say a few words at this
Okay,
point.
sir.
Yogesh sir, please.
Yes, Dr. Parikh sir.
Good evening. Please
Good evening,
go ahead.
Yogesh,
I don't want to come again in the between the academics. Please go ahead. But I only one line. Down syndrome. Please don't consider them down. They are differently able person with a different quality, excellent quality, like the music or singing or anything. So consider them as a differently able, not the down as a considered down. Thank you.
Thank you, sir. Now, for the today's function, very good academic function, we are honored with Dr. Atanu Badra, sir, as a chief guest. Sir is the treasurer of IIP 24-25. I request sir to have some few words for our guidance, sir.
Thank you, Dr. Pratibha ma'am. Finance has no relation with Downs, but I thank all the same to Maharashtra IIP, MahaIP, and of course, Women's Wing of MahaIP for inviting me. As Yogesh sir, our secretary, has said, Downs is not down. Actually, the initial word was Mongolism, but there was stigma attached to it. Though it was discovered long back in 1866, in the 1970s, it was changed to Down syndrome after the physician who published that article, John Langdon Down. So that's where the Down word came into use. And though it was we knew that what is Down syndrome, but the cause was not known because Dr. Dandev was not there at that time. So it took almost many years till a French pediatrician discovered the genetic cause of this. So I think it has a long history. But at the same time, we should consider everyone equal, because human beings are the best creation of God. But God doesn't send all the children as equal. They send someone with different abilities, different challenges, and different diseases. It's our job is to make them all inclusive and develop them as to see that they have the equal potential in education, in profession, in studies. And India has produced many of them. Sujit Desai was the first actor with Down syndrome who was known all across the Hollywood. Gopal Krishnan, he was also an actor. And finally, we knew that Dr. Miss Kimji was the Miss World of in the differently abled category 2023. So they can reach the top. And it's only we should be confident of them and provide them the support system. So let us go into the academics. I know though the focus of today's program would be, of course, on diagnosis. Dr. Sonali is there for helping us out, and Dr. Chopade would find out the genetic counseling, how to counsel the parents after we tell them that this child has Downs, because this is a problem that we face many times. Most of us have faced this, a very sentimental, how to tell them that you break the news, and then of course show them the light beyond the tunnel. And that, I think, is a very good thing. Thanks again to Dr. Pratibha ma'am, Dr. Jayashree ma'am for nurturing this program every Thursday, and Dr. Sanjay and Dr. Amol to providing this platform for the women's wing of Maharashtra IIP, setting the ball rolling across the country for a model education system. So over to ma'am.
Thank you, sir. Thank you very much for your kind words. Again, I welcome all the members, executive members, or my seniors, all my colleagues, and all the students who are attending today's program. Now, the time to start with our academic session. Now, we have two topics for today's session. The first topic will be taken by Dr. Sonali Pardi Mehetre Madam. She is a consultant neonatologist, Nashik, and for her, today's topic is overview of Down syndrome. Just a brief introduction of the madam. Can I get a slide for the introduction?
No, ma'am, I don't have.
Hello, ma'am.
Madam is a DCH DNB of IIP Neonatology, certified in neonatal functional USG as well as equine. She is a IBCLC also done. She is a consultant neonatologist and head of the neonatology department of KIMS Hospital Nashik and director of Cuddle Child Clinic Nashik. She is executive member Maharashtra IIP, our own women's wing Maharashtra IIP member, executive member 2025. She is a joint secretary Nashik for 2024. Chief editor of the first pediatric bulletin of the Nashik Pulse, and co-author of the book Pediatric Residency Made Easy by Evans Pub Publisher. She is the founder and member of online neonatology learning platform, that is Neonato Hub. Has been a part of many IIP community projects in the Nashiks. She is a scientific organizer at local and national conferences, speaker at 2 state conferences and various national and state conferences, published articles and cases in journals, and she's a true academician at heart and has presented her work at national and international critical care meet. Madam Sonali, Dr. Sonali Pardi, madam, I request you to start with your topic, that is overview of Down syndrome.
Sure. Thank you. Thank you so much, Pratibha ma'am, for such a kind introduction. Actually, I am also personally looking forward to Chopade sir's talk on genetic counseling. So I will try to wrap up and give an overview of Down syndrome from a perspective of a pediatrician and everything else apart from genetics that we need to know about it. So consider it like a crash course of Down syndrome, if I may say so. So without further ado, I'll just go ahead. So we know that Down syndrome so beautifully described the history, which was just given by we have been talking about inclusivity. So we need to understand it before we actually play a part in the inclusivity. So what is basically Down syndrome? We know that it is one of the most common chromosomal abnormalities among the live-born infants. and characterized by various variety of dysmorphic features. So the dysmorphic features, the congenital malformations, and all the medical and otherwise the conditions of which the child faces is what we are going to discuss here. So as rightly said in this photo, I don't have a problem. I have Down syndrome. This is what we want them to say. So as I'm not going to go into any genetic part of it. So let me skip this slide for right now. I'm sure sir is going to be talking about it as well. What we'll start off is, this is just 1 or 2 slides where we need to know about the antenatal diagnosis of Downs. So all of us know that there are quite a few antenatal screening tests which are available today for Down syndrome. This can be broadly categorized into a first trimester and a second trimester screening test. So what I need everyone to focus on is that when these tests are done together, as we can see, the sensitivity is much higher. So for the first trimester, if we take the entire maternal serum markers as well as the USG markers, it gives us a sensitivity of 85%. If we do the first as well as the second trimester screening test, which includes the triple test, the quadruple test, then the sensitivity of diagnosing Downs goes as high as 94%. And this is why, personally, I feel every pregnant woman should be given an option of Down screening. Coming to the test, which is other than the blood test, is ultrasound. So there are 2 things which are majorly seen in ultrasound, something called a major markers and something called soft markers, which by itself as a single parameter are not diagnostic, but when they are seen as 2 or 3 soft markers together, the probability that the child has Downs is higher. So the classical ones which we know of are our knuckle thickening. So anything more than 6 mm is very classical for Downs. One thing which is quite commonly missed is a hypoplastic nose, or something called an absent nasal bridge. I'm sure the PG people, this is one of the questions in their vivas. Other than that, mild ventricular dilatation, hyperechoic bowel, shortened limb, widened pelvis, and echogenic intracardiac foci are again some of the findings which can be seen antenatally in a baby with Down syndrome, in a fetus with Down syndrome. So this is the same thing that I mentioned about. These are our soft markers, which include our choroid plexus cyst as well, mild pylectasis. Mind you, single parameter of this significantly associated with Downs, but these are soft markers. So if more than 2 are present, we have to consider the possibility of this child having Down syndrome and go ahead with the screening tests as well. So now coming to the neonate. So after a baby is born, what we classically see as the facial features of Down syndrome may not be very obviously seen in a newborn baby. So how do we diagnose Down syndrome at this point? And we'll see later why this is important, because certain screening tests have to be started right from birth if possible, and that does help in the management of Downs babies. So this is a very classical Hall's criteria, which I'm sure everyone knows about. So this contains 10 parameters, including poor Moro's reflex, hypotonia in the baby, fat facial profile. Sometimes we can classically see the upward slanting palpebral fissures, a small round dysplastic ears, some redundant loose skin at the neck. The senion crease, interestingly, which we say is diagnostic of Downs, is seen in only 45% of Down syndrome. So not every baby who has Down syndrome will show the senion crease at birth. More than that, the other markers are a little more sensitive. So in this criteria, if more than 6 out of these 10 signs are present, there is a very high probability that this baby has Down syndrome. So we need to screen the neonate itself. This is again something which is very interesting in academic side, research side right now, which is called dermatoglyphics. We don't really have too much time to go into each and individual, but these 5 dermatoglyphic parameters are again seen to be associated with Downs, which is more than 10 ulnar loops, 80-degree angle, didn't go into details. I just need to have a sensitization that this is also a very good research entity right now in Down syndrome. Now coming to, I'm not sure how clear this picture is. It's showing a little unclear on my side. This is what Down syndrome is. What are the medical comorbidities that we see with a kid with Down syndrome? And this is right from head to your toe. So this is a picture which is grossly telling us about there would be growth failure, there would be decreased IQ, there will be classical facial features of this child. The hands can be short and broad, the high arch palate, a big macroglossia, a protruding tongue, dental anomalies, even some skin ridges patterns might be there. There will be GI, cardiac involvement, GI involvement, genitourinary involvement. We know there is an atlantoaxial joint involvement in these kids. So not every kid has everything of them, but a screening protocol is very essential to make sure our Down syndrome baby stays healthy for a lifetime. So this is what the facial features are very classically of Down syndrome. We all know of a flat nasal bridge. Okay, then macroglossia and a protruding tongue is again something which is found to be associated with Down. Not necessarily all the features will be seen in all the babies. The other thing that we see is an Mongolian, like upslanting of the palpebral fissures. There can be microgenia. There could be Simeon crease, which is a single horizontal palmar crease. There could be a wide saddle gap, which is the gap between the first and the second toes. So these are more or less grossly what Down syndrome babies will have. So these are the actual clinical pictures. As you can see, these are the findings which can be seen in Down syndrome. So now these are the phenotypic features, the external features. So why do we need to know that this baby has Downs? Why do we go through the trouble of diagnosing? This is because there are so many multiple morbidities and some of them can actually be life-threatening. And we need to screen them earlier once we know that this baby has a possibility of being a Down syndrome, and we need to test this child as well. So these are all the various systems that can have problems, medical issues in a Downs baby. Let's just run through them one by one as much as possible. So this is one thing which there is a growth retardation, which means there is a more or less a short stature. However, interestingly, most of these babies have a low weight to begin with, but obesity is one of the parameters which have been seen associated with Down syndrome in a long stay. So majority of the kids, they do turn obese beyond a particular age. Now growth rate is reduced. So one thing which we need to know of in a Down syndrome, and as a take home message again, is that there are specific growth charts for Down's babies. So their growth has to be monitored, their growth has to be plotted as per the specific Down syndrome growth charts and not on our conventional regular growth chart. So as we can see in this picture, both the girls, there is a definitive height and weight difference that we can see. But for our Down syndrome child, this is normal for her age because we are plotting it in the Downs chart. Now, coming to the first thing that most of the parents are actually worried about is the neurological for the neurological course of the baby. So a realistic picture is that mostly all the Down syndrome kids have cognitive impairment of some sort. Most of them have an IQ ranging between mild to moderate IQ, which is around 50 to 75. There could be developmental impairment, which is very apparent in the first year itself of life. And there are delayed milestones. In fact, we have milestones of like how we have growth charts for Down syndrome, milestones for the Down syndrome kids. Other than this, there are multiple disruptive behavioral disorders which can be seen in these kids. There could be conduct disorders. ADHD is known to be there in Down syndrome. Aggressive behaviors are known to happen. And autistic spectrum diseases are also not very uncommon in them. They are quite often seen in these kids. Coming to now, after CNS, let us talk about our cardiovascular system. So approximately 50% of the kids with Down syndrome have congenital heart diseases. And sadly, because the Hall's criteria is not something which is very routinely done, and unless the child has very obvious features of Down syndrome, it's very easy to miss in the neonatal period. More often than not, these kids come with a heart disease and then they are evaluated, and somewhere we land up with a syndromic baby, and then it turns out to be a Down syndrome baby. And contrary to what we think, that tetralogy is most common, it's actually atrioventricular septal defects, which are seen in around 45% of the Down's kids. Other than that, VSD, also PDAs, which can be a large PDA, isolated PDA, can be seen commonly in your Down syndrome kids. In adults with Down syndrome, the valvular regurgitations, like mitral valve regurgitation, is quite common. So that has to be again evaluated. We'll talk about the screening in these kids. Now, coming to your gastrointestinal issues, again, there are multiple things that have to be considered while seeing a Down's kid, because there is a possibility. It might not be there in every Down syndrome kid, but it is it has to be ruled out. So the most common among this is your duodenal atresia with or without annular pancreas. We know that esophageal atresia, tracheoesophageal fistula is also known to be seen in these kids. Hirschsprung disease is also not as uncommon. It's actually quite common in a Down syndrome child. Coming to eye features, what we concentrate generally when we talk about a baby with Down syndrome is Mongolian slant. That is an upward slanting palpebral fissure. But we have to get the eye screening done quite regularly for these kids, because they are very prone to have myopia, hypermetropia. They can have strabismus, cataracts, glaucomas are known to be common in them. Certain times keratoconus and blepharitis can also be seen. So eye checkup is very essential for a Down syndrome kid. Coming to after eye, the second sensory part, which is the ear. Now, sadly, around 38 to 78% of the kids with Down syndrome have some degree of hearing impairment. So, of course, hearing screening has to be done in any kid where we are suspecting or have proven Down syndrome. The commonest issues are your sensory neural hearing losses. Other than that, your conductive hearing losses, we know that otitis media is also quite common in these kids. So the screening, again, screening is something which is mandatory when we have a child with Down syndrome, so that there can be early detection and early treatment of any of the comorbidities. Coming to endocrinology, the most common endocrinological conditions associated with Down syndrome are, first is thyroid disease, which is around 3 to 54%. And hypothyroidism is very commonly seen in Down, so much so that every Down's baby at the first point of contact has to get a thyroid evaluation done. Apart from this, the risk of type 1 diabetes mellitus also is increased in the child with Down syndrome, and evidence suggests that the risk can be 3 times higher than your normal regular kids. So that has to be screened again, and especially because obesity as well is an additional factor. So we have to look at the endocrinological screening of these kids. Hematological disorders, the 3 important things that we see are these. The kid can have a transient myeloproliferative disease. There could be acute megakaryoblastic leukemia, acute lymphoblastic leukemias, and the risk is around 1 to 1.5% in Down syndrome. So a peripheral smear, again, within the first year of life is mandatory whenever we have a kid who has been suspected or diagnosed with Down syndrome. These are some of the other systems where I'm mentioning it to cover all the parameters, all the comorbidities which may be found in a Down's kid. So in pulmonary, we know that Down syndrome kids of somewhere around 7 years, 8 years, 9 years, the obstructive sleep apneas are very common. and these have to be dealt with as and when the child presents with the symptoms. Other than that, there can be pulmonary vasculature disorders, there could be chronic aspirations, recurrent respiratory tract infections are also known, and parents have to be counseled at every point of contact about the high risk of these recurrent respiratory infections in these kids. Dermatologically, we have something called a palmoplantar hyperkeratosis in around 41% of the kids, seborrheic dermatitis, fissured tongue, cutis marmorata, alopecia areata as well. Now, reproductive system wise, women with Down syndrome are fertile, and nearly all the males with Down syndrome are infertile. This is something which we need to know of as a pediatrician, because these are the questions. These are all the different questions the parents want to know, and that's why we need to know about it. Coming to certain neurological abnormalities, cryptorchidism is seen in many kids with Down syndrome. It has to be specifically looked at, and especially most of these babies are hypotonic. There is a possibility they are hypothyroid, and so the test is examination is mandatory in a male child with Down syndrome. In around 13% of the kids, there is some degree of atlantoaxial instability. And what is worrisome is that it might lead to a subluxation of the cervical spine and cord compression. So this also has to be screened in any child with Down syndrome, especially around this 1 year of age. Immune deficiencies are known to happen, and arthropathies are again known to happen. So this is a complete overview, and as I said, a crash course for the medical students as well, for what are the things that can be seen in a Down syndrome baby. Now, coming to practicing pediatricians, what we should be more aware of is, what do we do with these kids? So what do we do when we are suspecting Downs? What do we proven Downs? So the important thing is that we don't need to be sympathetic. We have to be empathetic towards the parents while providing any information. So because there is a little shortage of time, I'm not sure how much time I'm taking. I want you to focus on all the red markings, because these are the highlights of this entire busy slide. First and foremost thing is, even while providing information about a Down syndrome to families, don't forget to first congratulate the parents for the birth of their infant. Because this is still a good news. Down syndrome can have beautiful life ahead of them, and that is what we need to tell the parents again and again. Discuss the strengths of the child, discuss the positive family experiences. This child are really social. They are the ones who give happiness to everyone around them. Just mention it to the parents. What is other thing which is important to mention is an efficacy of an early intervention. The program has to be explained to them. The interventions have to be explained to them, and we need to be patient, because they are going to have lots of questions, and we need to have the answers with us, and we need to provide them in a non-judgmental way also. So encourage them to participate in therapies, encourage them to participate in the group discussions, support groups, and that might help the parents to cope up with the news of Downs, and after that comes the medical part of it. Now, this is one of the guidelines. So when we check online, there are a lot of guidelines which talk about screening of Downs. There might be plus or minus as per the country norm, but generally what we need to know about is my this thing pointer visible?
Yeah, madam.
Yeah. So we need to know of is all these. At the time of birth, the most important is an echo evaluation of the child. An audiologic evaluation has to be done at birth or at the point of first contact. Ophthalmologically, make sure that we check for red reflex at least before you even send them to an ophthalmologist, to make sure that there's no congenital cataract that we are missing out. We have to do a screening for thyroid, that is hypothyroidism, at the point of first contact again. Other than that, as we had talked about, within preferably within the first year of life, one peripheral smear with a good hematologist to make sure that we are not dealing with any kind of myeloproliferative disorders. Commonly, they are seen somewhere after the first month of life, but it has to be nevertheless screened. If the child is seen having any feeding issues, then a swallowing assessment has to be done at that point. And these are the rest of the things. Now, this does look like a very busy. So one very simple, straightforward and beautiful plan has been given by our own Indian Academy of Pediatrics. And this is a simple chart, which we can even put up in our clinics, which says how to do a growth assessment. Check the weight, height, head circumference, plot in the Down syndrome charts every 3 months during the first year and every year thereafter. This is the minimum, the bare minimum that we have to do. Hearing evaluation, which can be OAE at birth or BERA 3 months after birth. This has to be done at least twice in the first year of life and then yearly thereafter. The eye evaluation, as we mentioned, the red reflex has to be checked at birth to make sure cataract is not missed. And after that, every 6 months in the first year, every year till the age of 5 years, and every 2 years till the age of 12 years, and so on. Thyroid profile at the first contact. So, example, even if the cord sample turns out to be a normal TSH level, do repeat the thyroid at complete thyroid profile before 2 weeks of life or at the first contact, and at least 6 months again and 12 months in the first year, thereafter yearly. Heart, as we said, the screening has to be done immediately at birth and then as it is needed. So many of these kids do have obstructive sleep apnea. Sleep studies should be done at least once by 4 years of age and as needed thereafter. And again, because leukemias are known to be there in these kids, a blood evaluation also is needed. This book, which I have mentioned on the right side, this is a very beautiful and very simply placed guidelines for parents, which we can actually suggest to our parents of Down syndrome kids. Now, how Down syndrome is treated is never to be said. Down syndrome is about management. It is about giving a good quality of life. So the main things are therapy, any assistive devices, occupational therapy, basically, which the kid might need as and when they need. Certain prescriptions, for example, your thyroid supplementation if the child is found to be hypothyroid, and surgical SOS as and which comorbidity the child has had. So these are more or less the gross management of a Down syndrome. However, these are the therapies that we have highlighted. However, one very, very important thing is to counsel the parents about what they can do to not just keep the child healthy, but to keep the child healthy, happy, and having a fulfilling childhood. So, I've mentioned it as 1, 2, 3, 4, 5. So, of course, again and again, tell them the importance of the program, give them a printed or a written plan of how often they should screen, and medical care, regular checkups, regular vaccinations, along with this, a balanced diet, making sure they have good and active lifestyle is what is very important. The second important thing that parents can do for this kid is your early intervention therapies. So early stimulation programs go a long way in helping these kids with Down syndrome. This can include speech therapies, occupational therapies, physical therapies, and the inclusive schools. I encourage a communication, which can be gesture-based communication, sign language-based communication, and make sure the hearing screening is not missed at any cost for this kid. Coming to the next is a very, very essential thing which has to be done is making sure that the child has an emotional and social well-being. So they have to be taught the self-care skills like dressing by themselves, eating, basic hygiene. There could be group activities which the parents can plan play dates for these kids. Basically, a positive reinforcement, making sure that the child feels a part of the community and not something different from the community. We have been talking about inclusiveness, and this is where it begins. So encouraging and having goes a long way in boosting the confidence of this kid. Creating a supportive environment, making sure our friends, our extended families, they are educated about Down syndrome. They don't approach the kid in a sympathetic way. They approach the kid in an inclusive manner is what is important. Also, we have to make sure that the parents themselves are mentally, psychologically ready to deal with everything that is going to be associated with Down syndrome. And here the group support groups, parental groups come into picture. So as we have seen, regular medical checkups, early interventions, therapies, emotional and social well-being of the kid basically make these kids are by themselves very confident, very happy people. They make everyone happy. So they have to be given that boost, confidence boost from early on, and a supportive environment. And of course, preparing them for the future, teaching them life skills. As most of our senior dignitaries, they have mentioned again and again, these kids are really good in many of the things. It could be music, it could be your drawing, your arts. So along with this, there are so many Down syndrome adults who run successfully their shops, and money management, basics cooking, basic social etiquette, slowly and gradually, but have to be trained to them. There has to be a planning for long-term care for these kids and ensure that the kid knows socialization and is socialized, which helps in further activities later on in life. So this is again the same thing, because this is a very beautiful resource, and I request everyone to go through it and make sure that our parents of Down syndrome kids also get these resources. So again, the same slide, that this is not a problem. It's just Down syndrome. So thank you everyone, and thank you Maharashtra IAP platform for giving me this opportunity. I know it was a little fast track, but I hope I have covered most of the things. Thank you so much.
Thank you, madam, for your elaborative, but still it is a wonderful lecture for the Down syndrome. Definitely, madam, your key message, that is a screening, very important screening regarding the ophthalmic, regarding the ENT, eye, ear, as well as the thyroid screening. Definitely, madam. Just I want to share a 5-year-old female child with Downs with mother came in OPD in Dr. PDMC Amravati at first contact. Mother complaining of mother both. Baby was frightened, mother was scary. Mother complaining of starting of menses at the age of 5 years. Just we did a thyroid profile, turned out to be hypothyroid. Started with thyroxine, restore normal, stop the menses, and again restore at appropriate age. Definitely, madam, the role of screening, as you said, 3 to 54%, all of them, they are hypothyroid. Definitely, we will follow what you said. Thank you, madam.
Great presentation, Sonali.
Thank
Your
you.
slides were amazing, amazing.
Yeah.
And
Thank
the way
you,
you
sir.
presented was very good.
So the only worrisome part was that there was no clock. So I was worried, and I personally am waiting for Chopde sir's lecture. So yes.
Yeah, definitely. Our Maharashtra IP Women's Wing chairperson, Dr. Jaya Shivalkar, madam. I think madam is available. Jaya, madam. Okay, I welcome madam again. Then we move to the next topic. Again, second topic is understanding Down syndrome, genetic and genetic counseling by Dr. Nandev Chopde sir. Sir is President, Down Syndrome Care Association, India, Nasik, since 2007. Sir did MBBS, MS, and particularly the sir is PhD in medical genetics. Sir is Director and Consultant, Medical Geneticist and Genetic Health and Research Center, Nashik, 2003. It's honor to us that sir is with us, and just I request sir to share, to guide us regarding this genetic counseling, the genetics of the Down syndrome, which is very, very important for this Down syndrome patient. Over to sir.
Thank you so much, ma'am. Good evening, everyone. After such a nice, elaborative talk of Dr. Sonali, my job is very simple. And before I start, I would like to know how much time will you allow me to speak?
I think, sir, you can.
It's already 9:53.
Yeah.
So 20-25 minutes?
Yeah,
Yes,
sure,
yeah.
sir. You
Yeah,
can
definitely,
take
sir.
you
Perfect.
can take
We
your
are
own time,
waiting.
sir. You
We
can
are
take
Thank you
your
so
own time.
much. Thank you. Yes.
Okay.
So let's begin. So my topic is about genetics simplified, genetics of Down syndrome, and genetic counseling every pediatrician should know. So let us look at the ideal case scenario. So a pediatrician or a genetic counselor providing the genetic counseling which is appropriate, which is correct, which is non-directive, unbiased, and see what the result is. So as an ideal scenario, this is it. Long story short, this is how it is diagnosed. So the story begins after birth. We are not talking about yet to be born babies or parents at risk of having a child with Down syndrome. We are talking about a child born and identified as having Down syndrome. So maybe a neonatologist immediately at birth identifies that the baby has some features of Down syndrome, suspects, and he orders a test, gets the report. The report comes and confirms the diagnosis of trisomy 21. And then the pediatrician or the neonatologist fixes the appointment for further counseling or refers the case to genetic counselor for further comprehensive counseling. What happens in between? So as soon as the news is declared, the parents receive the report, diagnosis. What happens with them? There is you can say the initial shock that is happening there in the mother and the father and the family. Many questions they crop up. Could there be any mistake in the report is the first thing. How could it happen? How could it happen with us? We don't have any family history. Did we do any mistake during the pregnancy or thereafter or earlier that resulted into this abnormality? Could it have been avoided? So there is you can say, a sequence of emotional experiences parents are going through. There is a shock, there is rejection, there is doubt. Maybe this is associated with the guilt and blame and anxiety. At home, there is a lot of conversation happening. The elders, relatives, friends, they are contributing, often misunderstood information. And the questions again come like, does it mean to be parents of a child with Down syndrome? What does it look like to deal with the child with Down syndrome? What will be the life for our family? So there are many questions. Where can we get support? So there is indecision, there are dilemmas, there are questions, and then they go to the genetic counselor or the pediatrician for further counseling. So what happens in the ideal scenario is the counselor explains the genetics of Down syndrome, what chromosomes are, how they are inherited, how trisomy 21 is inherited, what is the nature of this trisomy 21, the random occurrence, spontaneous nature of the occurrence of the condition, what trisomy 21 is, what Down syndrome is, nature of the condition, prognosis of the Down syndrome, associated likely health issues, and variability of the presentation. So as Dr. Sonali rightly explained, all the medical issues associated, I'm not going to talk about that. The most important part that the counselor is saying here is the variability of the presentation. And maybe that they have a question about what next. So the counselor is also talking about the chances of recurrence in future pregnancies and the available tests for dealing with the risks. Then the counselor explains the available support. So explains about the means for powerfully dealing with the condition, need for other testing for associated health issues, health checkup plans, need for multidisciplinary support, early intervention programs, support and care required at home. So what parents should be doing, should not be doing, existing support groups, the community support programs, government support systems, all the information. Whatever is available for dealing with the condition, the genetic counselor explains that. This is it. Then he listens very carefully the concerns, questions of the parents. Listening, as in the world they are living in is a real world, and the concerns they have are the real concerns. He carefully listens. He is compassionate, empathetic, and then he provides all the other information relevant from that perspective. So he provides accurate medical facts, stresses again on the variability, focuses on the abilities rather than the disabilities, respects their emotions, views, autonomy, and he thoroughly, throughout, is being compassionate, non-directive, and unbiased. And the counselor shares the details of contact details required for the follow-up support, literature on the Down syndrome, and schedules for the future counseling sessions and the health checkups. Now, with this information and the ongoing support, parents take all the steps suggested by the counselor proactively. They completely accept the child as it is, provide a nurturing environment, take support of early intervention, health checkups, inclusive education, and community support programs. And you see that the parents, family, and the child is happy. So this is what is seen. What you see in the children who have accomplished something, and they are the examples for the other families or the children, where they have received some kind of appropriate and accurate genetic counseling, and they have taken all the measures to deal with the condition. Excuse me. So in conclusion, this story is this way. When diagnosed, parents are gripped with fear as they are told about the challenges the child will have to face. Years later, if they are going through this appropriate space of communication and counseling and support, years later, the same mother, she is crying of joy watching her daughter play her part at school with confidence. The same mother realizes that the compassionate support of the counselor and the existing support system has made their life and the life of their child enjoyable. These are the experiences shared by most of the parents who are really happy with their child having Down syndrome. So this is a long story made short, an ideal situation, and you will see that this is seen very rarely there in the practice. So our job today, our talk today is about this. What is the role of a pediatrician or neonatologist or a geneticist or a genetic counselor in empowering the parents and the children with the Down syndrome condition? So before we go into that part, let us look at the genetics of the Down syndrome in brief. So we know Down syndrome is caused by the extra chromosome 21. 95% of the cases, they show free trisomy 21. Some of the cases, they are mosaics. Around 1.5 to 1 to 2% of the cases, they show mosaicism. Some of the cases, they show the translocation involving chromosome 21 with any other or acrocentric chromosome. And some of the cases, so rarely, will show the partial trisomy 21. Now that the maximum cases are, 95% cases are free trisomy 21. If you see 100 babies with free trisomy 21, you will see a very wide spectrum of phenotypes in all these babies. So one thing is, depending on what chromosomal complement the baby is having, whether it is free trisomy 21, mosaicism, translocation, or partial trisomy 21, the phenotype will vary, definitely. Second thing is, amongst those having the same karyotype, again, the phenotype is going to vary a lot. And the phenotype is caused by the genes which are present on the extra chromosome 21, that is overdosage of the genes. These are some of the important genes which cause the phenotype and the different disabilities in the child. So we are not going to go in details of all this. Here is a list of the genes given and the role each gene plays in the overall development and the phenotype of the baby. Now, depending on the chromosomal complement, whether it is free trisomy or mosaicism or translocation or partial trisomy, this dosage will vary. And depending on the dosage, the phenotype will vary. In a same phenotype also, the genes expression and the variability of the expression of the genes. So maybe that every one of you knows that most of the genetic disorders that we're talking about in Mendelian pattern of inheritance, they show variable expressivity. These genes also, they show the variable expressivity. So if you're talking of babies with free trisomy 21, all babies, in these babies, these genes also, which are in the same dosage, extra dosage, will express variably. And that's why it will result into a variable phenotype. These are the different variable domains, and I'm not going to go in details of that. Ma'am Sonali has explained it very nicely. Let us look at the genetics in brief. So what causes the variability of phenotype in the Down syndrome individuals? Genetic factors for sure. One is the type of chromosomal abnormality I was talking about, whether it is trisomy 21, translocation, mosaicism, or partial trisomy. Second is the variability of the genes which are in extra dosage on this extra chromosome 21, that is the gene expression variability. And third is the impact of the rest of the genome on this genes on the extra chromosome 21. These are the three factors. Apart from this, these three which we have inherited from our parents, the child has inherited from his parents. Apart from that, there is a big mechanism, what we call as epigenetic mechanism, that is at play, which is because of the DNA methylation and histone modifications caused by the environmental factors or the random, unpredictable biological variations, what we call as stochastic factors. In the environmental factors, whatever exposure the baby has got before the baby is born, like the parental age at conception, prenatal exposures to teratogens or drugs or infections or whatever, nutrition, maternal health, these are prenatal. Postnatal, how and what environment you are providing, how you are nurturing the child, what is the emotional environment around the baby, what are you talking about, what are you thinking about, what kind of care, healthcare interventions you are offering. It makes a definite impact. So if you are looking at the world of variability in Down syndrome, we can't do much about the genetic factors that the baby has inherited. We can't do much about the epigenetic imprints the baby has got prenatally, but definitely we have an access to the postnatal epigenetic phenomenon. I must stress this again. We have access and only access to empowering the children, individuals with Down syndrome. The only access that we have is to modify the epigenetic imprints, the epigenetic mechanism of the child. And how can we do that is a part of the genetic counseling. Yeah. So as I said, we can't do about this. We can't do anything about this, genetic aspects. But definitely, when a nurturing environment is provided to the baby, nurturing environment includes all kinds of physical, mental, emotional, healthcare, social environment in which the baby grows, including what we believe, what we think, what we are clear about, what we expect, what kind of nutrition we are providing to the child. Everything impacts the expression of the genome. The whole genome, including the extra 21. So here is the access. Quality of healthcare, medical interventions, nutrition and overall physical health, educational opportunities that we offer, inclusive education, early intervention therapies, different kinds of therapies, including speech, occupational, physical therapy, inclusive family and social environments. The most important from my perspective as a geneticist, and that I want to emphasize more on today, is the attitudes, beliefs, and expectations parents carry about the condition, about the child, and about the world around. There is where the transformation is required. There is where the role of doctors, clinicians, pediatricians, counselors is very, very important, which includes the language that we use, a very powerful, empowering language that can shift the perspective of people of looking at the condition and at the child. That makes the real change. It impacts the overall growth and development of the baby profoundly. It impacts the child's health, happiness, development, and independence throughout life. So if this is so, that you can't change the genome, you can't take out the extra chromosome 21, you can't take out and block the genes on the extra chromosome 21, you can't change the prenatal epigenetic imprinting. The access that we have is this. If you just start thinking about it, the first thing I would like to say is, everyone with me? And everyone wants really to know what kind of genetic counseling a pediatrician is supposed to know. I'll be very happy if I could really pass on this message today, and this is delivered. Simple shift in the language that we have. Just imagine for a while, we have been listening for the last 1 hour, whatever we are speaking, like Down's child, Down's baby, Down syndrome child. Use instead a child with Down syndrome and see what happens with your own self. Just experience what shift is happening in your own perspective. Nothing wrong in the language that we have been using so far. A simple language shift. Down's child, Down syndrome child, and a child with Down syndrome makes a huge difference in our understanding of the condition, in our understanding and perspective towards the child. This kind of language shift is required in the parents who are coming from, there is something bad, there is something wrong, there is something that should not be there. When we come from that language, parents are bound to come from that language. When there is a shift in the language that there is nothing wrong, there is nothing bad, there is nothing that should not be or should be, whatever is there as it is. And there comes the acceptance, without which there is no possibility of empowerment in the world of Down syndrome, rather in the world of disabilities. When we talk of the counseling, genetic counseling to a child with Down syndrome or any child with genetic abnormality, or for that matter, to any child with any disease, the kind of clearing that we are when we are approaching that condition or the family, the beliefs and attitudes, ideas, cultural embeddedness that we have in the background makes a huge impact in what is delivered, what they receive, and what they translate into their actions. Let us look at what happens. There is a chain of reactions impacting the family and the child when the diagnosis is received. So parents receive the diagnosis of the Down syndrome. There is a shock, as in what happened. They were living in a dream world. They were so excited, so happy to have a cute baby. There is sudden shock that there is something wrong. What happened? And then there is a denial. This can't happen. It can't happen in our case. There is no family history in our family. We didn't do anything wrong. Doctors said everything is right and perfect. Then there is upset because of failed expectations. Slowly, whatever they expected from that child will grow and we will do this and that. Everything is gone. Failed expectations. There is a guilt, maybe. This happened because of me or because of you. If it happened because of me, there is a guilt. And when I say it has happened because of you, there is a blame. That game begins. There is anxiety thereafter, anxiety of the future. What is going to happen next? Now that this baby is having Down syndrome, maybe they have got information from the clinician or the doctor or the friends or the internet. They got to know all that. This is what it is. This is how the baby is going to be. There is a lot of anxiety created because in the future, there is darkness now. There is cynicism. Slowly, as they run from door to door, hospital to hospital, doctor to doctor, and they see there is no possibility as such. There is no possibility, they say. In that case, there is a kind of cynicism. Nothing can be done about it. And then ultimately, it results into what we call as a resignation. As in, it is impossible. Nothing can be done. It is impossible. I'm not interested in doing anything. These parents, they start moving away from the scenario. So for your information, you must be wondering why I'm drinking a lot of water. I'm on certain medication and my mouth is getting dry again and again. So I need water regularly. Okay. So here you see that the impact is parents run away from the situation. They are running away from the society, from the family, from their job, from the action they are supposed to take. This is what happens when they are not getting the appropriate support, counseling. This is the regular scenario, the chain of actions, chain of emotions. When they run away from the situation, the condition, they are not able to deal with, maybe mentally or sometimes even physically. Sometimes even I have seen families wherein the parents are separate out. There are divorces happening. There are fights happening in the family because there is someone to be blamed. They run away from the situations. And when they run away, they are not taking actions. The actions which are required to take to empower themselves and the child. What we're talking about in the world of genetic counseling is empowering parents. Whatever is there are early intervention centers at every district place, at every hospital. There are pediatricians who know well how to deal with, how to tackle, how to treat, how to do the operations if it is required, cardiac operations, how to deal with the hypothyroidism, how to deal with physical conditions, how to deal with emotional conditions, how to deal with the cognitive domain. We have everything in place. These parents who are running away from the situation, they don't take any action as required, and that results into the loneliness or hyperactive child. This is what happens. Most of the children who are unattended, because the parents are resigned and cynical about it, the child is either completely lonely, aloof, unexpressed, or the child is completely hyperactive and it seems really impossible. There is no possibility of growth and development in the scenario. So if you get what is happening on the emotional plane, you will get present that the key factor in the overall growth and development is not the availability of the facilities, is not even the doctors and the healthcare professionals and the therapists, is the attitude of the parents, is the empowerment of the parents, the possibility of optimum development of a child with Down syndrome, or for that matter, any child, whether the child is able or disabled. Can we reframe the question? If we think of the possibility of optimum development, can we reframe the question? What is the question? The question that we had been talking about for a very long time is, what is less? What is not possible? That is what I have observed over the last 20-25 years. I'm associated with this. I'm the founder, president of Down Syndrome Care Association. I'm practicing as a medical geneticist for the last 30 years now. And most of the times, the conversation is happening around Down syndrome. And I have listened to it again and again and again. Nothing is possible. What is less? What is not possible? Which results into disempowerment. And there is a more focus on the disabilities rather than the abilities. Can we shift this to This is it. Now what? What is possible? How can we support parents in accepting the child, engaging in proactive care and empowering the child with Down syndrome? So that you have all the support in the world required for growth and development of the child. But if the child is not brought to this, if the facilities are not used, nothing is going to happen. And that happens with the empowerment of parents. So our role in communication and counseling is not counseling the child with Down syndrome, but counseling the parents, clearing their mind, wherein there is complete acceptance as it is. As in, there is nothing wrong. There is nothing bad. There is nothing that should not have been. You are going to create a space, the space of compassion, respect, empathy, comprehensive care, wherein people enter in with lot many concerns they have. They have questions, unclarities, worries, tensions, anxiety, all that, good, bad, right, wrongs, with lot many questions, what, why, how, when, and where. They enter in that space. You are creating and holding that space through which these people are passing. And as they come out of that space, they are satisfied, happy. They are in the mood of acceptance. They are responsible for whatever is there. They are responsible for to do and not to do. They are proactive in taking all the actions required. They are free. They have power and self-expression. They are doing whatever is required to do to deal with the situation, and they take support of the existing system. For that to happen, we as the counselors and all the pediatricians must get present to something. There is a clearing that we all have in the background. Like when we start talking about genetics, we start talking about the prevention of the birth of a child with Down syndrome or prevention of a birth of any child with any genetic abnormality. As in, that is something wrong. We must get something for ourselves in clearing that the child doesn't know about trisomy 21. The child doesn't have any problem with having Down syndrome to trisomy 21 or any associated health issues for that matter. That is first thing we must know. Second thing is, parents don't have any idea about what Down syndrome is unless and until you detect and tell them. They are very happy, excited, enjoying with their little one. And we say something. And when we say something, if that is not appropriate, it is going to create a lot of chaos. That is going to impact the family. That is going to impact the child. And how is the child impacted is this. The disempowered, worried, and tense parents. They definitely are tense because of the dark future that they see because of the diagnosis. What happens with the child? A child reflects the parents' emotions, their behavior, their thought processes. It impacts the overall development of the child. There is what we call as mirroring. A parent who is unhappy is going to make a child unhappy. A child who is tense is going to make a child tense. A child who is running away will make a child to run away. As the child grows, you will see everything is reflected there. Parents who are proactive will make the child proactive. Parents who are happy will make the child happy. That is what happens. So if we want to empower the child, grow and develop the child well, allow the child to live in a happy environment, we have to empower the parents. For us to empower the parents, we have to clear our own ideas about right, wrong, good, bad, should be, should not be. So what is the role that we play and we must play in empowering the parents? So consider that you are the gatekeepers. We all are the gatekeepers to the world of empowerment. The world of empowerment, people don't have access to. They are already disempowered. They don't have any keys to that door. And you are the gatekeeper there. What can you do is create for parents. Create a space wherein they don't see that this is a fault of anyone. They accept it as it is. They don't blame. They don't get into guilt. you create that majority of the extra chromosome 21 are the sporadic events. It's not because it is inherited from one or two, mother or father, or it is inherited, or it is the fault of someone. And there is no risk of recurrence also, or very low, very low risk of recurrence. When you create that, you see the guilt and the blame goes down. When you create a space for forgiving, now this is what it seems like. It is not a medical scenario. It is a medical scenario. When we talk of healthcare delivery, we talk of health delivered in physical, mental, social domain. And we are not talking about what it looks like to be well in mental domain or social domain. It requires you to forgive people. It requires you to forgive yourself. If you think someone has hurt you by doing something wrong, blamed or said something wrong, forgive them. And who is going to do this? A pediatrician is going to create, a counselor is going to create a space in which parents get that clarity that I must forgive, and I forgive others and even self. If you think you have made something wrong, if you did something wrong, blamed someone, that hurt someone, forgive yourself. That creates freedom from guilt and blame. People who are either in guilt or blame can't create anything worthy on this world. Who always complain about self or others, there is no possibility of empowerment around. The first thing is getting them away, getting them clear, free from that guilt and blame. You must create the space wherein people express gratitude for having a child, gratitude for to people who have supported them in every scenario. Whatever way people have supported, expressing the gratitude. Expressing gratitude for being alive, expressing gratitude for having a child. Maybe the child has Down syndrome. What pediatrician can do is have a very clear and powerful listening, active listening. Active listening is what people need. It's not the selective listening or pretended or what we call as the selective listening itself. A listening where you are actually engaged into their world, listening to their concerns, worries. Maybe you can't do anything, but you just listen. As in you are with them. Make them experience that you are with them. People remember what you say, how do you communicate, and what you don't say throughout their life. Listen clearly. This empties out the burdens, anxieties. Highlight strengths first. So instead of talking about what is less, what is abnormal, talk about what is there. Talk about what are the abilities, what are the potential possibilities that will clear them, free them from the anxiety. Give them information about all the support systems existing. So empower parents for the proactive healthcare and follow-ups, which will include health checkup plans, all kinds of therapies, early intervention programs, inclusive education, social interactions, spatial education if required, and joining and participating in support groups. This is what is available for dealing with the condition. So here are the 6 domains. Providing compassionate, unbiased, non-directive genetic counseling. Every word has a deep meaning. We must give a little thought to what it means to be compassionate. Before we be with someone, before we be compassionate with someone else, start being compassionate with self and experience what it looks like to be compassionate. And you will see that is an amazing thing that can happen in the world. There's an amazing thing that you can offer and provide to people. Unbiased requires you to inquire your own thoughts. Dig deep, find out what is there. As in, we all have something in our mind that comes from right, wrong, good, bad, should be, should not be. We are biased. We are culturally embedded. We have our own beliefs and ideas, and we enforce, knowingly or unknowingly, we enforce those through our conversations and communications. Just getting present that I am biased, there is a possibility of keeping it away. So getting present to the biases and non-directive. If you just get present to how many times and how frequently you are getting directed in your communication and counseling, you will see that most of the time you are that. Even in a counseling setting, it happens most of the time we are that. There is nothing wrong with it. Just get present. Whenever you find yourself, catch yourself being directive in communication, stop and just look at how can you be non-directive in communication. Emphasize the importance of the tests, regular health checkups, and follow-ups. People don't understand that. They take it easy many times. So emphasize it upon the investigations. Guide them towards the local early intervention centers. Now that every district place in the state has got the early intervention center, a huge facility government has created. People are not taking support of those facilities. Make them aware that there is a center wherein they can get a support free of cost and all the therapies under one roof. Introduce them to the support groups, community empowerment programs, community support programs, like our organization, Down Syndrome Care Association, which is offering the empowerment programs for the parents and the children for the last 18 years. So you can guide them to get registered with the Down Syndrome Care Association. Family empowerment and acceptance, nurturing environment. So create a possibility of how can they nurture the child. What happens when the child is nurtured well? Nurturing involves not only the nutrition and the physicality of it, it involves mainly the emotional aspect of it. How loving environment is created around the child, empowering environment is created around the child. That makes a difference. Inclusive early education opportunities. So it is the pediatrician that can play a role in guiding and directing the parents, empowering the parents in taking help of all the available existing systems, support systems, healthcare facilities, and the early intervention programs. Can we celebrate life with Down syndrome? Here are some of the examples wherein life is being celebrated. So that number of examples have been given earlier of people with Down syndrome who have achieved excellence. Here are some of the examples. From Nasik, we have Swayam Patil. So he's around 15 years old now. He holds 2 international records, world records to his credit for swimming. He has received the President's Award twice. He is in himself an example and an ideal for people in the world of disabilities, not only in Down syndrome. Prathamesh Date, who is from Ichalkaranji, Maharashtra again, he is working as an assistant librarian in a college, reputed college in Ichalkaranji. He is a winner of the multiple awards, including the World Down Syndrome Day Award 2012 for outstanding self-advocacy, and he has received the President of India Award twice. Pranay Burde, that Dr. Amol was referring to, he's from Mumbai. He is working with the 5-star hotel for a very long time, for 18 years. And he is an independent person, walking on his own, running on his own, traveling on his own, doing the things very nicely. He's again the awardee, twice awardee of the President Award, and he is also the awardee of the Down Syndrome International. Here are many such examples, thousands and thousands of examples world over where the children with Down syndrome have shown excellence in different fields, different domains. Neil Joseph from UK, he's 40 now, says, having Down syndrome hasn't defined who I am. It has opened lots of doors for me. And there are so many such examples wherein people say, it is good to be a person with Down syndrome. Here is Down Syndrome Care Association in brief. I'll just give you some idea about what we do so that you can talk to people and refer them to get registered with this organization. Down Syndrome Care Association India is the registered charity organization established in 2008. I'm the founder and president of this organization for so long, and we are committed for empowering and enabling the individuals with Down syndrome and their families. Here are different programs that I have been conducting for creating awareness and empowerment on different platforms. So there are workshops organized, special guidance is provided by the experts. We conduct rallies and meetings for social inclusion and awareness. We have been organizing the special exhibition on Down syndrome called as Akashi Jepaghere Pakhra, wherein all information about Down syndrome is displayed and people ask questions, and then we explain everything about what it is and how we can empower this world. We distribute the literature and create the platforms for public interaction with the children. We are recognizing and promoting the talent through cultural programs, through felicitations of those who have excelled in different fields. We organize the workshops and special guidance by the experts on various aspects like yoga, meditation, drama therapy. Then there is a expert parent interaction, expert parent workshop, parent workshops, nutrition and psychology, health checkup camps. Every year, at least one health checkup camp wherein we have 12 to 15 specialists coming together, offering the health checkups to of the children. And we get children and the parents coming from Maharashtra and the nearby states in Nasik. We have conducted once a national symposium for Down syndrome, wherein we got the participants from all over the country to create the awareness at the national level. And we have been celebrating World Down Syndrome Day from 2006 on a huge scale. Slowly after the COVID, this has gone down, but then we are still conducting the programs. We had an activity center wherein children with Down syndrome only used to come, and we used to empower them through all the activities that we have been doing. I'm providing free Down syndrome clinic and counseling on every Friday from 2 to 4 for the last 15 years. So this is all about the Down Syndrome Care Association. Before I end, I must say, the purpose of all this is to listen for what they are dealing with, for what their concerns are, for what their expectations are. We are here to listen for, and then reliably deliver, consistently. Deliver what? That which makes a real difference in the world, in what they are dealing with and what they really care about. And in this process, we leave them happy, transformed, empowered, peaceful. That's the purpose. With this purpose in the background as a context, if we just give a little thought to what can I do, what is possible, it will give us all that what we as the clinicians, doctors, counselors are supposed to do. So with this, I'll end my talk. Thank you so much.
Thank you, sir. Thank you very much. I elaborate you, but very interesting talk about the genetic counseling. As you nicely narrated, sir, what next? There is a role of genetic counselor, pediatrician, and everyone involved in the care of the Down syndrome. Secondly, as you said, as the genetic aspect of the Down syndrome cannot be changed, but the epigenetic influence, epigenetic factors, we can to empower the Down syndrome baby again by genetic counseling. Definitely, sir. There is a role of this genetic counseling, not by geneticist, but by pediatrician and whosoever in the care. Third important message, key message from your lecture, that is you said about the community support. That is a pivotal in the Down syndrome patient, which ultimately improve the Down syndrome, all the aspects. Definitely the theme of today's is, or 21st March, is to improve the support system. But as I read the article published by you in the newspaper, that you are yearly gathering all these Downs all over India on 21st March in Nashik, and there is a support system, and definitely living or implementing this theme of improve the support system of this year theme for the Down syndrome babies. Thank you very much, sir, for your lecture. And I think this counseling is not only important for the Down syndrome, but for other diseases also. will be, everybody will have a clues that how to counsel, how to deal with all this patient. It is not the disability celebration, but it is a celebrating the ability of these children related not with the Downs, but the all other diseases. Thank you, sir. Now I request our enthusiastic and always the guidance of whom empower us, Dr. Jaya Shivalkar Madam, the Chairman Maharashtra IP Women's Committee, to say a few words for today's program.
Thank you, Pratibha Madam. First of all, heartiest congratulations to Dr. Sonali and Dr. Chopde for giving us wonderful insight. Actually, this type of sessions are very important for pediatricians in between, because for us, Down syndrome diagnosis is very easy. But what next? And when pediatricians don't guide the parents, they run here and there and take help of those who are not so expert. So, congratulations and thank you to both of you. I'm also happy to share that tomorrow same speakers, Dr. Sonali and Dr. Jnandev Chopde sir, are going to deliver same topics but in a different way to parents, rehabilitation professionals, psychologists. The Nagpur CRC, that is Composite Regional Center, has invited and partnered with Maha IIP. And we are going to deliver the same lecture, but in a different way, so that it reaches to actually parents, special educators, psychologists, so that they can guide parents in proper way, because they don't have correct information, especially about genetics and other these things. So tomorrow is also going to be a good audience, because it is going to be all over Maharashtra. They have circulated the flyer. We will also circulate the flyer in our Maha IP group and IIP group also. So you can also spread it to your parents also, or anyone who is in the rehabilitation, so that they also get the insight into this thing from experts. So thank you once again, sir, and Dr. Sonali. Special thanks, because she has taken the lead to plan this session, and heartiest congratulations to you. Yes. And
Thank you,
Dr.
madam.
Yeah, Dr. Pratibha ma'am,
Yeah.
this program has become so popular. Dr. Bivan has joined from UK, the coordinator of IIP UK.
Okay, sir.
So,
I welcome
you
on
have
the
an
behalf of
international
Maharashtra.
Thank you,
audience.
sir. Thank you.
Yeah. Welcome, sir, for the today's session. Okay, now I think जसं मंत्रमुग्ध होऊन आम्ही ऐकत होतो, पण आता थांबावं लागेल. Now I will start with for the vote of thanks.
Madam,
Ma'am, Dr. Samir Dalwai sir is there.
Acha, sir, Samir Darwai,
He
sir,
will
I
speak. And
welcome
Dr.
you for the
Bivan,
today's
if
session.
you have time, you please speak out. First
Yeah.
Samir Dalwai sir and then Bivan.
Yeah. Sir, just say a few words for the today's program.
sir, आप mute हैं.
Pallavi ma'am, please
Yeah,
unmute
let
Dalwai
Samir
sir.
speak first and then I'll come in. Thank you.
Yes, sir.
Yeah.
Permission is already given.
Yes.
Namaskar. Respected President, Dr. Pakmuruji, Secretary, Dr. Amol Saib, Chief Guest, and our dear friend and Treasurer of IIP, Dr. Atanuji, speakers for today, Dr. Sonali ji, Dr. Chopde Saib, and of course Jaya Tai and Pratibha Tai, and our guests from overseas as well as all our delegates from all over Maharashtra and India. Very, very nice deliberation, very nice talks. Both Dr. Sonali, Dr. Chopde sir, खूपच छान बोललात. आणि इट्स व्हेरी इम्पॉर्टंट टू ऑर्गनाइज सच टॉक्स एज वी सेड. डाऊन सिंड्रोमच्या बद्दल लोकांना बऱ्याचशा गैरसमजुती आहेत. यू हॅव क्लिअर देम. पहिली गैरसमजूत म्हणजे डाऊन प्रॉब्ली दे थिंक डिस्क्राइब्स द चाइल्ड. ही गैरसमजूत मोडली पाहिजे, कारण डाऊन इज द नेम ऑफ द डॉक्टर or the pediatrician who first described this condition. It does not apply to the doctor, it does not apply to the child, it applies to the doctor. आणि म्हणून हे नेहमी सांगितलं पाहिजे की मुलाला बघत असताना आपण बिचारे, गरीब हे सर्व या शब्दाने बघितलं की त्यांचा प्रॉब्लेम पण वाढवत असतो. त्यांना नॉर्मलच बघितलं पाहिजे आणि हा प्रॉब्लेम आपल्या डोक्यात असतो, त्यांच्या नाही. म्हणून न्यूरोरायझन्सला गेली 22-23 वर्ष काम करत असताना आम्ही एक ब्रीद वाक्य ठेवलेलं आहे की डिसेबिलिटी एक्झिस्ट इन द माइंड ऑफ द पर्सन who thinks somebody else is disabled. जर मला समोरचा कमी वाटत असेल तर त्याला मोठं करण्यात माझी कमतरता आहे हे मला लक्षात आलं पाहिजे. आणि जर माझी कमतरता नसेल तर मला स्वतः जास्त मेहनत करून तलावर नेलं पाहिजे, म्हणजे माझ्यात खरी क्षमता आहे, नाही तर माझ्यात कमीपणा आहे हे मला कळलं पाहिजे. आणि म्हणून ह्या ऍटिट्यूडने आपण जर बघत असलो तर कोणीच आपल्याला डिसेबल्ड, स्पेशल वगैरे वगैरे काही दिसत नाही. आपल्याला आपलं कर्तव्य काय आहे हेच दिसत असतं, आणि असं कर्तव्य फॉलो करत असताना आपली वाढ होत असते, आपला विकास होत असतो. समोरच्याचा झाला की नाही माहित नाही, पण आपला नक्की होत असतो. आणि अशाच प्रमाणे डाऊन सिंड्रोमची मुलं आपल्याकडे प्रॅक्टिसला आली तर आपण सर्व जनरल पिडियाट्रिशियन आहोत, आपल्याला खूप जास्त वेळ नसतो. ऑफकोर्स यू कॅन रेफर डॉक्टर चोपडे साहेब आहेत, सोनाली मॅडम आहेत, जयाताई बघतात. पण एवढं करत असताना फक्त मुलांच्या वडिलांना आपल्या बिहेवियर वरून त्याने डॉक्टर मुलाला पाहिलं त्यांच्या, अरे असं आहे का, बरं बरं, असं होतं कधी कधी, कधीच असं बोलू नये. अच्छा ठीक आहे, टायफॉइडच्या मुलाला बघितल्यावर आपण असं खूप डिप्रेशन दाखवतो, काय टायफॉइड आलं का, नाही, असं आपण वागलो आपल्या ह्या बॉडी लँग्वेज वरूनच समोरच्या पेशंटचं मन खचून जातं. तेव्हा बी नॉर्मल, काय नाही, हा प्रॉब्लेम असा असा आहे, याचं हे करायला पाहिजे. सरांनी मस्त लिस्ट दिलेली आहे काय काय करायला पाहिजे, ते सोनाली मॅडमने सांगितलंय. त्याच्यातलं तुम्हाला जेवढं आठवेल इन युअर बिझी प्रॅक्टिस तेवढं सांगा, बाकी एक्सपर्टकडे पाठवून द्या. पण एक सांगा, असं काही नाही हो, याच्यात काय काय करायचं असतं ते करावं लागेल. मलेरियामध्ये काही करायचं असतं, टायफॉइडमध्ये काही करायचं असतं, हे वेगळं करावं लागेल, तेवढं करा, एकदम बरं होईल. असं बोलून जर तुम्ही पाठवलात ना तर त्यांचा मनोबल प्रचंड प्रमाणे वाढतं, आणि दॅट मनोबल इज रिफ्लेक्टेड इन द चाइल्ड्स मनोबल इव्हेंच्युअली. नमस्कार, थँक्स अ लॉट, मला 2 शब्द बोलायचं तुम्ही संधी दिलीत, खूप खूप आभार. नमस्कार.
सर, धन्यवाद सर.
थँक्यू सर.
Vivan sir. Yes,
Hello.
sir.
Hi.
Yes, sir.
Hi. Hello. Sorry. I think I think I was overwhelmed by Dr. Chokardi's presentation, actually, with the amount of care and things that is outside medicine that we sometimes forget regarding looking after these children. This is a very topic which is very close to my heart because I run a Down syndrome follow-up clinics, especially from the cardiology aspect. I think two things. I think I'm more of a clinical person. I'm not going to Dr. Chokardi's factors that he has said, being a geneticist, which is probably a very important part for the clinicians. I think if you have a suspicion of Down syndrome on day 1 or day 2 of life, my practical experience will be, please send bloods after counseling family, send both a lithium heparin and an EDTA sample, because as Dr. Chokardi clearly said, there is a lot to do with mosaics and zounds, and so a QF-PCR as well as a full microarray is important in these children, because the extent of the Down syndrome will sometimes, for every time, will determine the prognosis and how these children will develop in time regarding their IQ and all other aspects. And from the cardiology aspects, which I usually impinge on, because no child should leave a hospital or without a plan for an echo, because a lot of these children have silent pulmonary hypertension, which without any structural problems. So we tend to scan these children within 2 weeks of life in my clinic. So I scan these children within 2 weeks. So even with a normal structural heart, these children can have pulmonary hypertension, which if not taken care of very early, they are irreversible, as you all know. So these are the 2 points I'd like to just highlight. That's it. Thank you.
Thank you, Vivan sir.
Thank you, sir.
Thank you, Dr. Vivan.
Amol sir, can I move?
Yes, please do it.
Yeah. Now it's a time. विदा घ्यायचा टाइम आहे हा, वाटत नाही आहे आपल्याला सगळ्यांना. खूपच सुंदर प्रोग्राम. First of all, I am thankful to our chief guest, today's Dr. Atanu Badra sir, for attending this session. Secondly, our President Maharashtra IP, Dr. Pakmode sir, for encouraging us for this program, as well as our Secretary General, Dr. Amol sir. Thank you very much. Our convener, Dr. Sanjay Deshmukh sir, as well as thankful to Dr. Jaya Shivalkar madam for empowering us for such a type of program. Maharashtra Women Committee Chairman, as well as very much thankful to our today's speaker, Dr. Sonali Pardi Madam, and Dr. Nandev Chopde Sir. A wonderful lecture by both of them. Definitely imprinted about the whatever they want to say. Definitely we will try to follow in our practice, whatever or whichever is possible by us. I am thankful to the co-chairman, Maharashtra Women Committee, Dr. Amok Shahane Madam, convener, Maharashtra IIP, Women's Committee, Dr. Kashmiri Badbade, and thanks to all my Maharashtra IIP Women's Committee executive body members all over Maharashtra, as well as thankful to all executive members of IIP, Dalwai sir, and as well as thankful to all my seniors and colleagues who attend this program for which prolong or lasted for a long time. And last but not the least, the IT expert for this wonderful session, smoothly conduction of this program. Thank you. Thank you very much to everyone.
Thank you.